Hi, I'm Michael Messier, and this is my work, Automated On-Site Fall Risk Assessment in Older Adults. Falls cause 85% of injury hospitalizations for Canadian older adults. Thankfully, risk can be reduced through exercise and assessed with mobility tests. The CDC recommends 3 tests: a timed up and go, where patients are timed as they stand, walk 3 meters, return, and sit down; a chair stand, where patients stand and sit for max reps in 30 seconds; and a balance test, where patients try to hold 4 positions for 10 seconds each. Max comfortable walking speed is also used to predict falls. Fall prevention should be a closed loop, where tests guide exercise choices and are redone to update training over time. Vivifrail is a validated system to help this process. Adults can receive a Vivifrail grade through testing, and each grade has an exercise program appropriate for their current level of fitness and fall risk. Objective testing has traditionally been too expensive and slow for clinical use. Instead, clinicians test manually, which makes testing slow and sensitive to interclinician variability. As a result, testing is rarely systematic. Computer vision is a new tool that tracks the 3D location of body parts with AI. It has potential to support quick, accurate, repeatable, and cheap fall risk tests, but lacks application in real-world assessment. We hypothesize that open-source computer vision can automate fall risk assessment in retirement home settings. 17 older adults performed 3 rounds of the aforementioned tests. Our recording setup was cheap and simple with 3 webcams, 2 USB cables, open source software, and an analysis code I wrote myself. This code identifies events like standing from a chair. This is the forward and upward head path of the motion. There are 2 parts, a lean forward and a push up. We take this path and focus on head height as time passes. Again, there's a dip with the lean forward and rise with the push up. My code matches this template to a trial using dynamic time warping, a technique that squishes or stretches the template to find when it best matches the trial. This graph is head height through time in a timed up and go. We warp to find the start of the stand up and end of the sit down. This is head height in a chair stand. It rises and falls with each rep. We warp to find the start of rep 1 and count the rest by tracking a subject's knee angles. These are foot speeds from a balance test. The spikes are the subject stepping. We get bounce times by tracking when both foot speeds are below a low threshold. For walking speed, we measure the time a subject takes to walk 3 meters, then calculate an average speed with the known distance and time. Here's a full analysis for one person, with their timed up and goes, chair stands, balance stages, and walking trials. We use the best result from each to assign Vivifrail scores based on literature standards. For the timed up and go, they were below 20 seconds, fall risk negative. For the chair stand, they did 8 reps for a score of 1. They finished balance stage 3 for a score of 4, and their walking speed was 0.76 meters per second, a 3. These scores are added to assign a Vivifrail grade. This subject was graded C and would be given these exercises. My code automates this whole process. This is every timed up and go from our first site. A valid time was taken from every one, and results were similarly consistent across all of our sites and tests. Here are the results for everyone. We have timed up and go times, chair stand reps, walking speeds, and the highest balance stages completed. What's key is that my system took these measures automatically across a range of mobility levels. It also automatically assigned Vivifrail grades. This study demonstrates the feasibility of automating fall risk assessment using open source computer vision. Our setup was cheap and simple, and it reduces workload and interclinician variability versus manual testing. Our lab's next goal is to integrate my work into a user-friendly application for healthcare providers. Let's return to the fall prevention loop. An easier testing system will encourage frequent tests and exercise prescription to reduce falls in our aging population. Thank you. Here are my sources and acknowledgments.